Great. All right. Thank you so much for joining us today, Dr. Tran. I appreciate you being here.
Thank you for having me. I'm really excited
Absolutely.
to be here.
Yeah, absolutely. So let's just jump right in. I know we were talking a little bit beforehand, but I'd love to just share with our audience a little bit about your journey and how you got into Airway.
Yeah, so I started off just being curious. There were two major things I would see in the dental office just as a regular pediatric dentist doing exams, and two major complaints. One was my kid grinds their teeth a lot, and the other was, um, I'm brushing and flossing and feeding them the right things, and yet they're still getting cavities. And so
Mm,
both of those things I never had good solid answers for. And then one day I met a good friend of mine, Mary Ellie Mitchell. She's a occupational therapist
mhm,
and does myofunctional therapy as well. And she was like, hey, you're a pediatric dentist. You do tongue ties. And I'm like, no, I don't. Why do you ask? And then when we started to get into it, I realized like, oh, okay. She was like, it can cause ADHD. It can, lead to all these problems, feeding issues, speech issues. I'm like, okay, they can grind their teeth. And I'm like, whoa, okay, teeth grinding. Then it caught my attention.
mhm.
And then I started going down the rabbit hole like anyone in the space does.
Right.
She led me to the Academy of Orofacial Myofunctional Therapy.
Mhm,
And I went to their frenulum inspection workshop. And one of the speakers that they had there was Sarush Sagi. And
mhm.
I'm very evidence-based. I don't like to do things without good solid evidence or just good science behind it. And he presented some pretty good, compelling arguments about tongue tie and functional problems. And it looked like that he had been doing some studies around it. So kind of like following him around after that. And he created the Breathe Institute after, and just
Mhm.
started taking courses and learning more and more about it. But when you have patients who have a problem that you cannot solve, or your answer to them is, oh, they'll grow out of it,
Yeah.
you just know that's the answer you give when you don't have an answer, you know?
Mhm,
And
mhm.
so when I finally found the answer, I'm like, these patients need help. And so it all had to do with, what does teeth grinding mean? And it means, oh, you're grinding your teeth, there's some sort of stress. And we knew that. That's something we learned in dental school. It's a stress response.
Mhm.
Okay, well, why are they stressed out? Well, it could be that they're not breathing well in their sleep. And well, why are they not breathing well in their sleep? Oh, well, could be that their airway's getting obstructed.
Mhm.
And then I started to learn, okay, where are some areas where your airway can get obstructed? Could be the nose, nasal cavity, adenoids, soft palate, base of the tongue. Oh, the base of the tongue. Okay, that makes sense. That's my space. I work in the mouth.
Right.
So then you start to understand, okay, tongue tie can relate to this, because when the tongue is tied, the tongue is down low. You can have a low resting tongue posture. You might
Mhm.
have poor tone because you're not using it correctly. And that can fall back into the airway during sleep. That's where the obstruction can occur. Now, when you're not sleeping well, when you're not getting enough oxygen, and that your body gets stressed out,
Mhm.
then the stress response happens, the teeth grinding. And that made a lot of sense to me. It made
Right.
absolute sense. And so, you know, that was the first thing that got me going down this rabbit hole and wanting to help solve this problem for a lot of families. And a lot of it also, it spouted a lot of other questions like, well, how do you treat it? And how do you treat
Mhm.
it well? And how do you get good results? Because that's the other side of it. Like, sure, it
Right.
makes sense, but can we actually help the families with this? So I've been doing this ever since then. I want to say like it's been about 8 years since I got into this. And um, there's been more and more information, evidence coming out on it. And
Mhm.
the studies are there. And I've always been on this mission to help all of my colleagues to understand this and educate parents on this so that indirectly the medical community will eventually accept it. And that's what I want. I want there to be more acceptance around this so that we can help more families, because there's nothing more disheartening as a provider when a family comes in and they're like, you know, it makes me feel good because they'll go to all these people who will say, sorry, we can't help you, or they kind of gaslight the parents and make them feel crazy. And then they come to me and I answer all their questions.
Yeah.
And I give them a solution. And then they're like, why did it take so long for us to get here? Why didn't my pediatrician just refer me? Or why didn't my dentist just refer me out? And the answer to that is simple. Well, they just don't know.
They don't know. Yeah.
They don't know. We're not taught this in formal medical and dental education. So it's not necessarily their fault. So that's where I'm like, okay, I need to educate my patients really well so that they can also bring that information back to their pediatricians and dentists. And I want them to know that this isn't just some hippy dippy voodoo.
Right. There is science. There is factual evidence. Yeah.
Exactly. Yeah. And so it's really important to me that when I communicate and educate these things, that it's done accurately and succinctly, that there's clear understanding around what the likelihood of improvement will be, and that there's also clear understanding about what the diagnosis is. So diagnosing properly is key, and getting a good diagnosis can be tough to get to. Sleep studies.
So how do you go about that?
Oh yeah, that's it's a whole exam that I do in my office. But I guess what do we want to get? Diagnosis around tongue tie or sleep issues?
Let's start with the tongue tie. So if you
Okay.
suspect your child has a tongue tie and they were to come to you, what does that process look like?
So I usually will do a functional exam, because when there's a tongue tie problem, there's a functional problem. So I always relate it back to this to the parents. If your child is tongue tied, think about what the tongue does. It helps with sucking and swallowing, especially for an infant earlier on.
Right.
It helps with feeding, because the tongue has to move food around in the mouth for chewing.
Sure.
It helps with speaking. You have to use your tongue to talk. If you didn't have a tongue, you couldn't talk. And then there's the breathing sleep component. So the tongue has to be in the right place for you to breathe properly. Not that it has to, but it's ideal that it's in
Sure. Yeah, because you can breathe when it's down low, but it's not where it's supposed to be.
The best breathing.
Right. It's not optimal. Right.
Exactly. So when I tell parents these functional problems can be present, sometimes the parents are like, well, my kid's fine. They don't have any problems with that. I always have to explain to them, it's not about whether or not they can do it. Because just like we said about the breathing, sure, you can breathe with your tongue down, but it's not ideal. It's not optimal. Just like you can speak with the tongue tie when your tongue's not working correctly, but you might not be speaking correctly.
Right.
So,
and you can stick your tongue out with a tongue tie, but maybe you're not sticking it out as far as it's supposed to go, or
exactly. So I bring it back to the basics, that when you have a functional issue or a tongue tie issue, everything in your mouth, it's a fine motor skill. It's not gross motor. Like if your child has a problem with walking, that's a gross motor skill. You're going to see it and you're going to want to address it right away. You're not going to just let that slide. When it comes to the mouth, this is a fine motor skill, and you might not see when there's a problem. And usually what will happen is if they can't do it correctly, they're going to compensate. And those compensations will turn into other issues. So the example I like to give, I'm always giving the same example, is, okay, if your arm is tied to your side, and you need to grab something off a shelf, and your arm can only lift maybe 20% of the way off your body. There's other things you can do to reach what you need to get off the shelf. You can either bend over, get on your tippy toes, reach up. Maybe you get it off the shelf. You can go get a ladder bring it over, climb up the ladder, grab it off the shelf. Okay, you achieved your goal. You got what you needed off the shelf. But the first way you did it hurts your body. Your body's compensating in some way to get it. The second way is really inefficient. You have to go get a ladder, climb up the ladder, it takes more time. So I'm going to relate this back to infants. So we see this in infants that are tongue-tied. They're still feeding. They're okay. They can take a bottle. They're still getting breast milk from the breast, but maybe they're taking a long time. And so that's where I help a lot of parents. Because I get a lot of parents that come, they're like, well, I'm not having any pain. Why would I do this procedure when there's a tongue tie? Well, it has to do with how your baby's compensating. And so if they can't do it efficiently, if they can't use their tongue efficiently, then they'll take a long time or they'll tire out. You keep doing the same way, I'm tired, wear out, fall asleep. Now we gotta wake them back up, feed them some more.
And they could suck in a lot of air and things too, correct? Which now we have an upset stomach and all these other issues to do.
Reflux, all of that, yeah. But the basics to it that I want all of the parents to know and understand, like the take home to it is like, it's up to you. You can leave it alone, but when you compensate, it's going to affect something else. Something else is going to give. And that something is going to be your jaw development. It's the craniofacial growth and development. And that's where when we get the older kids, and when I say older, I'm talking about 3 years old.
Right.
That's when you're about
different realm.
Yeah, and the head and neck grow at a different rate than the rest of the body. By the time they're 3, for instance, their cranium, their head, is 90% their adult size. So that's how much growth has already happened through 3 years old. Then the face is no different, the jaw growth, 70 to 80% by the time you're 3 years old. So if they're not functioning well to start, they've already impacted the growth significantly because a lot of it has already happened. Then by the time they're 3, if they want to fix a tongue tie problem, it's not just, okay, let's fix the tongue tie and let it go. You have to make space for the tongue, because part of fixing the tongue tie isn't just we snip, let you go, all is good. Because my favorite way to explain it is, all I'm doing when I do a tongue tie release is I'm giving your tongue range of motion. I'm allowing it to move freely. I'm not teaching it what to do.
I was gonna say, you still have to train it.
You need a therapist to teach your tongue what to do. So when at 3 years old though, they have to use some myofunctional therapy before I do the release, because they have to know what to do with their tongue, because that can also impact the healing. So that's another factor that's really important, is making sure it heals well. And that's what I've learned over time in this last 8 years. You can't just do a tongue tie. I did it in the beginning. I would release tongue ties because that's what you kind of do in the beginning. You're like, oh, this will help my patient, and you release it. But actually, no, it didn't help the patient. Why didn't it help? Oh, it's because it didn't heal well.
It didn't know
Why didn't it heal well? They needed therapy. So therapy is really crucial and important to the success and successful outcome of doing a release.
But therapy before and after.
Yes. Yeah. Because before, it's giving your tongue awareness. After, it's teaching it what to do with its new range of motion.
Okay.
So, sorry, can I pause just a moment?
Yeah. Yeah.
So they figure out. Okay, sorry. Can you hear me a little bit better? Okay.
Yeah. Yeah.
It was a little bit noisy too. One of my assistants has her baby here. So, okay. So going back, so to get a successful outcome with the procedure, they have to do the therapy before and after. I kind of lost my train of thought now, what I was talking about.
Right. We want to do it before and after. We're training it.
When my girls are loud, I can't.
I understand.
You can edit this, right?
Oh yeah. Oh okay. Yeah.
Making sure. Yeah. But the Oh, doing a tongue tie release. I was talking about when you do a tongue tie release, they have to do the therapy before and after. But there was a point that I was getting at. So when I do a release, all I'm giving the tongue is range of motion. They don't know what to do.
Mhm.
So they have to train for it. And when I would do the releases and they weren't successful, I think that's where I was talking about.
Mhm.
There was a point I was trying to get to. Gosh, I wish I could listen to myself talk and what I was saying.
You were at the very end, you were talking about in the beginning, you didn't know about the myofunctional therapy and you just released them and they weren't successful.
Yeah, so this is just to say, like, no, there was another point I was trying to get at. And gosh, I've never had this happen to me before. Mom brain, I think after having a baby, this sort of stuff happens. So.
It does. It totally
I
does.
I can't draw from my memory as well as I used to. I used to just like get back on it really fast and be really sharp. But with all the experience that I've had in doing all of this, and when you do a tongue tie release, the success of it, gosh, I can't, like, this is really eating at me right now because I can't.
Oh, it's okay.
It was saying,
We could back up a little bit and see if it'll trigger it. We just kind
yeah.
of start talking about that you have to have, why is it important to have myofunctional therapy both before and after?
What I was talking about before that was about like what the tongue does and how it helps with function. So those are the main things that the tongue does. And the original question was about how we treat, how you can tell there's a problem.
Right.
So the compensations. Oh, okay. I know what I was getting at now. So,
okay.
So the thing is they have to do the therapy before, they have to do the therapy after. And then before that though, if there's no space in their mouth to even do the therapy to begin with, then it's a moot point to even do the therapy and do the tongue tie release. So by 3 years old, when they come to me, when they're an older child, I have to create space too. So now there's more involved in treating the problem. It's not like what we do for an infant. An infant, yes, they might need a little bit of training, but the therapies may be like a couple weeks.
Oh, wow.
Maybe 4 weeks max. But when it's a child, it's usually several weeks or months before we get to doing the release, and then several weeks or months of therapy after the release as well. But if while they're doing the therapy, they have to suction their tongue up, they have to move their tongue side to side, we want to get them full range of motion. But think of the tongue as the car and your mouth is the garage.
Okay.
The garage is too small. And if it's too small, the car can't move within it. It's stuck.
Right.
And where does it go? Can you shut the garage door if the car's sticking out? No. So if you want to shut the garage door and you want to breathe with your mouth closed, the tongue's got to go back. And that's going to impede your airway. So we usually, before we do therapy and release the tongue tie, create space first. We have to expand the jaw, make it bigger. And it's because of how the tongue tie affected the growth in the first place. And so this is a really important concept that I want parents to understand when they come into my office. And just I want most people to understand in general, because even pediatricians don't know and understand this. This is science that we know about. There's no arguing this at all.
Okay.
As the upper jaw grows, our bones are in separate pieces. Okay. And I have like a little skull here to show
perfect.
These different pieces. Okay. All these areas between each bone, each of the separate bones is called a suture. And the suture, we have one right down the center of the palate, right down the middle, and it splits our palate in half from front to back. Now, when the tongue rests up in the palate, it will put pressure on the palate, and that sutural opening will widen, and then new bone will grow in between. That's how the upper jaw grows.
Okay.
The lower jaw growth follows. And then this is the growth center of the face. So you can see the upper jaw is also attached to the eyes, also attached to the nasal bone. It makes up part of these other structures, part of the cheekbones. So when this grows, the rest of the face gets to grow with it. But if it doesn't, then everything else stays small too.
Comes in.
Yeah. So if the tongue doesn't rest up and the jaw doesn't widen, you might get a narrow face. And that's what we also see in mouth breathing. So it's not just tongue tie. There's other reasons, and this is also important for a lot of practitioners and parents to understand, is that sometimes when we talk about tongue tie, we're like, oh, that's the problem. Let's get to the problem. It's tongue tie. It might not be. There's other reasons why people mouth breathe. It's not just low tongue posture. It can be from allergies, nasal cavities too small, turbinate inflammation, lots of problems, adenoids inflamed. So then you can't breathe through your nose. So that might induce mouth breathing. And then that also, if in order to breathe through your mouth, your tongue has to stay down low. You can't put your tongue up and breathe through your mouth. It's impossible.
Right.
So that low tongue posture, then again, if it's happening in a child, that will affect their craniofacial growth. And then so by the time they're 3 years old, 70 to 80% grown, and they've been mouth breathing, well, we've already had a major impact on the growth and development there. So we have to jumpstart that development, make that space before we release the tongue tie. But in that regard, when you understand that, you understand why mouth breathing should not be done early on in life because of how it impacts the jaw growth. And what is involved later on to help that is to expand, which is actually really easy to do in a 4 and 5-year-old. And I typically do it around that age 5, 6. I've done it as early as 3 when it's needed.
Okay. But it's more complicated as we get older because everything's a little more established. It can still be done.
So that suture I was talking about, that's fused. The process of fusion starts around 7 years old, but it's fused by 12 years old.
Oh, wow.
Yeah. And so this is really important to understand too, because once you reach 8 years old and you're trying to expand, there's some mechanics around it that you have to understand around it, is that we put the expander attached to the teeth and there's a little jack screw in the middle. I'll show you what that looks like. Kind of looks like this.
Okay.
So this sits on the teeth. You've got a jack screw in the middle here. The parent turns this once a day. It expands by 0.2 millimeters. So you're only widening by 0.2 millimeters. But what I want you to understand about the mechanics behind this is when the suture is really wide open and you're pushing on the teeth and the teeth have really long roots, it serves as a good anchor and you can get that pressure open in the center. But as that suture starts to fuse, you can't get that pressure there anymore. It starts to push more on the teeth, and the roots of the teeth and the baby teeth are starting to dissolve because new teeth are coming through.
Right.
And when you're trying to anchor on the teeth and you're pushing on it, now the teeth start to push out. So you do get a change in the dental arch. It looks wider, but really what's happening is the teeth are tipping out. You're not actually widening here in the center of the palate.
Okay.
And we know that the research shows it in the orthodontic research. The older the child gets, the more dentoalveolar expansion you get, meaning the teeth move, and less orthopedic expansion you get, meaning you're not getting much of that expanded. So by the time you're 12 years old, or for girls, it's actually when you get your first period. That's when it's fused. So for some girls, that's 9 years old.
Yeah.
It happens earlier for girls.
So what do you do once it's fused, for somebody that has an older child?
We have to do something called MSE, maxillary skeletal expansion. So we actually will screw the jack screw directly into the palate with these mini screws. And that directs force directly around the suture itself, and then you widen at the suture. Now I want you to understand why this is important, because
a lot of orthodontists, traditional orthodontists will say like, well, we can expand at 9 years old. Sure you can, but you're going to get mostly dental alveolar expansion. You might not get that orthopedic expansion. And I want the orthopedic expansion because the roof of the mouth, we're not just talking about the upper jaw here. The roof of the
Mm-hmm.
mouth is the floor of the nose.
Mm-hmm.
And
Right.
so this is the growth center of the face. And as this is widening, the floor of the nose is widening. So look at the nose, it's like a triangle, and the floor is the base
Mm-hmm.
of that triangle. So if that doesn't widen out, triangle doesn't get bigger. It stays small and narrow. And now you've got less space to breathe through your nose. So then now you've got a nasal breathing issue. That what we're finding now, what new research is showing is that when we expand in adult, it was a study that came out of Boston, and this doctor, he showed that when you expand just 1 millimeter of the palate in an
Mm-hmm.
adult, you increase the nasal volume by 2.4%. So if you expand, you're like doubling it, more than doubling. If you expand 7 millimeters, you're going to, increase the nasal volume by at least 15%.
Wow.
You can breathe that much better through your nose. And it's important to know this because when I get a child or a teenager or an adult in here that comes to my office with an airway issue, who has
Mm-hmm.
difficulty breathing through their nose and has a narrow palate, I want them to know, yes, we need to expand you, but there's a certain way we have to do it properly to get true orthopedic, palatal, and what we call nasomaxillary expansion. So the palate is part of the maxilla. The
Mm-hmm.
floor of the nose is part of the nose. So that's the nasomaxillary complex that we're addressing. And I send to specific orthodontists, airway focused orthodontists who understand that. And they know how to do this and they have experience with it. Now, say an adult wants to do this,
Mm-hmm.
suture's fused, and for men, the bone is really dense. So you can't just screw it in there and open it up. We actually have to do what's called a corticotomy and cut open the suture in the center of the
Oh,
palate. It's actually not that bad. It
I was gonna
sounds
say it sounds horrible.
horrible, but it's actually like Dr. Richard Ting. He's in Rancho Santa Margarita here in California. I refer to him a lot. He does this. It's called a MARPI, mini implant assisted rapid palatal expander. And so there's a certain way, like other mechanics to it. You have to custom make the expander itself, and it has arms on it that help direct force and pressure in the right places. And then
Okay.
it gets screwed into the palate. We cut open the suture before we screw it in. But there's really like advanced imaging that we do, like state of the art imaging with cone beam CT. We get
Mm-hmm.
3D rendering of the entire skull to map that out, to plan it. Then the lab makes a custom piece that fits perfectly into your palate. The screws have to go in a very specific place so that you have good anchorage.
Mm-hmm.
And then when you start expanding, what happens is the adults will get a gap between their teeth, which is a good sign. It means you're
Oh,
actually
wow.
expanding where you're supposed to expand. So,
Wow.
but you can talk to the adults who do this and they'll tell you it helped, they could breathe better through their nose. That's one of the things that improve for them
Mm-hmm.
when they do this MARPI thing.
That's
So
amazing. Well, it makes sense too, right? Everything's pushing up. So
yeah,
curious because when you opened the skull and you were showing the suture, it looks flat up there.
yeah,
It looks flat and smooth.
yeah.
What if you have a bump down the middle?
Oh, that's called a tori. So that's something where somebody experienced who does this all the time will know how to manage that.
Okay.
That's hollow bone. It's not really strong bone. So it's something that they have to consider when they plan this, whether or not they can do that for you. But that you'll have to talk to somebody who actually does that frequently. And I know just from groups that I'm in and all the orthodontists that I talk to, and I've taken the courses and I'll learn about it, but I don't actually do MARPI in my office. I might do
But if
some
your child has a
assisted.
bump up there, there's still
There's still
somebody
a
that could work with
possibility
that.
to do it.
Okay.
But honestly, in a child, they rarely have that torus. It's called a
Okay.
tori. They rarely have that there. That's more something, a complication that has to be dealt with for an adult. And
Oh,
usually
okay.
that comes from functional problems. If you're like clenching, you don't have space, that's more likely to develop. I have one up in my palate, actually.
I have one too. That's part of why I was thinking about that. And then I was, when you popped that open, I was thinking about, when my children were younger, what that looked like. And it occurred to me, that's what my children look like, but mine doesn't feel like that. I feel this bump.
Use your body, the more other problems will arise from it. And you'll, like I always say, something's got to give. Your way of compensating is going to affect your body in some way, and it's going to show up. And that's one of the ways it will show up, just like with tongue tie and compensating. It shows up in how the jaw develops. So,
And it makes a lot more sense to me too. Especially, now that you understand that the tongue, it's not just here, it's going all the way down. And so now you understand, when Dr. Liao was on and he talked about, you can see a child's gait and you can understand there's something there.
deep frontline fascia is what it is. Yeah, what you're talking about. That tongue fascial tissue, connects all the way down to the toes. It connects to the diaphragm. So we actually see an infant. So I see a lot of infants in my office. And one of the things that we do to help those infants is recommend body work. Because when they're tongue tied and they're so tight there, it's pulling on their diaphragm as well. So when I refer to body workers, I don't just refer to anyone. I refer to the people who understand this concept that the deep frontline fascia connects from the tongue down to the diaphragm to the psoas down to the toes. So you really do have to do a full body release and help the body open up because it's been so tight all this time.
Right.
So when I do a tongue tie release, they do some body work before, but it's really important to target it after. And as soon, like immediately after the procedure, because that's when the baby is the most loose. And we want things to stay loose so that it heals loose. Otherwise, if their body's still tight and they maintain that tension, then the tongue will actually heal with that tension as well. So then we essentially didn't do anything.
Makes sense.
Yeah.
So I want to, and I'm caveating this for anybody that's heard this. I'm not bringing this up just for the sake of bringing it up, but other parents, our listening parents, saw the article in the New York Times about what was it, the booming business of tongue tie releases, and you had a really great response on Instagram. And so, just for the parents who haven't seen it yet, and I'll link to it in our show notes, but would you mind sharing a little bit about your thoughts on the article and where you stand on this concept?
I think my thoughts are probably more philosophical, but I really believe that patients or people who are involved in tongue tie, I see both sides to it. I see people, especially when I first got into this and I wanted to learn about it. I wanted to learn because I was seeing that parents were having a hard time getting help from their pediatrician. Then we would do the procedure and they would get improvement. So it's like, this is really frustrating. All the pediatrician needed to do was refer them to the right people, and they could have had this problem solved instead of suffering for as long as they did.
Right.
But then I would also see groups that were doing tongue tie releases on everyone. And they weren't doing therapy. They weren't recommending all this other, they were just doing the procedure. And it was like a mill. And the article specifically talks about a lactation consultant. And we have that problem here in Orange County. There's a lactation consultant nearby that works with a dentist in another group, and they are just everybody who walks in the office. And mind you, the lactation consultant is not allowed to diagnose the problem, yet they're doing it sometimes. Not all of them. I work with plenty of lactation consultants who know, I think this is a problem for your baby. This is probably why the breastfeeding experience isn't going well. You should go see a provider who can diagnose this, and then they'll refer to me or other providers around here. It's not just me. And I think that's important. You don't want them referring to only one person. They should recommend a few for you to go
Multiple,
to.
yeah.
So, and that way you as a parent can make a decision. So I'm not against the fact that they wrote about this. I think that's information that's really important for parents to hear, that does exist. But just like in any industry, there's bad apples in every industry.
Right.
So it's the same here. I think that it does hurt families, but did you lose me for a second?
Yeah.
So the problem with the article is that it does hurt some families from getting the help that they need. Because since then, I have had some parents come to me saying, you know, I almost didn't come because of that article. My friend sent it to me, and then I'm like, that would have been awful, huh? And they're like, yeah, I would have been struggling even longer. And when I do the procedure for the baby and the mom gets to experience right away, I have them breastfeed in my office right away to try it out. And the mom's
Oh,
like,
wow.
wow, this is different. They feel it right away. They know the difference. Especially because I spend a lot of time educating. All this functional stuff, I go through like a PowerPoint presentation. I show
And that's
videos of
key, right?
swallowing.
The education piece is key so that
It's
everybody
so
understands and we're
important.
all working towards the same
Yeah.
goal.
Exactly. Like I want every family to know when they come into my office, and I'm training a new assistant. I was telling her this morning, I'm like, it's really important to me that the parents make a sound decision and that they're not pressured into it, and that we're
Right.
not using fear to, you know, get people to do procedures.
Right. Right.
Because that happens in every industry. You know, if you don't do this, this is
Sure.
going to happen. So instead, what I do is I educate. Hey, this is how development happens. And these are the things that could happen. I don't know if this is going to happen to your child. They might need these things anyway. But what I can tell you is if we do the procedure, these are the few things that it can help. And we're realistic about it. It's not a magic bullet. It's not going to solve
Mhm.
all your problems. Sometimes reflux can be caused by a tongue tie. Sometimes your baby also has a cow's milk protein allergy at the same time. And that's
Mm.
what's causing the reflux, not the tongue tie. And so when you're a provider who does this, you need to understand the differentials. And so that's also like a part of my mission is I want to educate providers who do tongue tie releases to understand, like, don't be so myopic and just focus on they have all these symptoms that mean tongue tie. That means we do a tongue tie release. No, you gotta know that other things can cause the same symptoms, and you have to be able to differentiate what those things are. And if you do the procedure and it doesn't help the parent, you have to be able to give them good advice of where to go, because that's why the parents are mad at the pediatricians in the first place. Well, they told me that it wasn't a problem, it's just a small problem, and they kind
Mhm.
of just left them hanging, like don't do the procedure, or you know, that's not good advice. Good advice is I don't know, I'm not sure, but this is where you can go to find out.
Right. And let's just watch it, by the way, is not good advice.
It's waiting and watching needs to be an educated decision. Okay, if we're waiting and watching, what are we watching for? At
Mhm.
what point do we decide to do intervention?
Right.
And that's what I spend time talking about with my patients when they come into my office. Okay, if you decide not to do the tongue tie release, that's fine. These are the things I want you to look out for. And this is an alternative for you if you don't want to do the procedure. You're too scared of it. Sometimes moms are dealing with postpartum depression and anxiety.
Yeah.
The post-op care is too much for them. They can't do it. You don't have help at home. You don't have anyone to help
Mhm.
you to allow this procedure to be a success. Okay, maybe this is not the right time. Do this instead. Let me give you some other support in the meantime.
Yeah.
So
I like that.
that's what we should all be doing in healthcare anyway. But you know, that article bringing those things to light, I think that it's good for parents to know that, to look out for those things. I think parents should take that article with a grain of salt. It doesn't mean don't do the procedure. It means do your research before you find a provider, before
Mhm.
you talk to them. Does their front office talk you through things? Are they using fear to get you to do it? They're like, if you don't do this, all this is going to happen. No, I don't like that. That is
Yeah.
not my approach at all. So the fear mongering happens in every industry. Don't do it.
Right. And you can't make a
think-
decision that way, right? That's
No,
not yeah,
it's
you
never a
just
good
can't do
way to
that.
make a decision based off
No.
fear.
No, it's not, right?
It is. So to make the decision to do nothing based on fear, not a good decision either.
Right.
So,
Yeah.
so the article is definitely extremely biased. I know that they interviewed a lot of other experts who had really great outcomes, but didn't include any of that information. So, you know, that's just how journalism is these days.
Yeah, it is. It is. So one of the things that you've mentioned a couple of times, and it's something we advocate. I think that's why I kind of picked up on it and latched onto it. You talk a lot about collaboration, especially with just all medical providers, like the whole realm. Let's all just start working together. So where did you develop this philosophy? Because, and with all due respect, they don't teach this in medical school. They used to 100 years ago, but they don't now. So where did this philosophy come from?
I think that one of the things in medicine that's a problem in healthcare in general is having an ego. I think a lot of people have egos that are doctors, and myself included. Sometimes I have to check myself. And the important thing is that when you practice collaboratively, you have to have enough humility and humbleness to say, I don't know all the answers, and I need to talk to these people to help me understand where I might be missing the mark, where I might not understand how to help my patient. And so I tried to take that approach to start, and that's how I started collaborating with other providers. So I'd go talk to chiropractors and other therapists, speech language pathologists, myofunctional therapists, ENTs, orthodontists, and sleep surgeons, sleep doctors, trying to learn from all of them. Okay, if a patient has this problem, obviously this is something I can't do, or it's outside my scope of practice. What should I look out for? And where can you help this patient? And when you start to learn what other people can do, it's not like you're going to do it. I don't want to do body work. I don't
Right.
like, I'm only doing early orthodontics. There's a certain age that I'll do expansion to. Like Marpies, I don't do them. I'll send to the orthodontist who does. That I adopted just from purely wanting to help patients and wanting to do what's right for them. And it goes back to the same thing that I said regarding the article. Like, when you're looking for somebody, somebody's claiming to know all the answers to your problem, probably not the best person to go to. Like, we all have to know we don't know everything. And schools, education, and the way that the healthcare system is set up these days, it's highly specialized. So you either get a provider who's the jack of all trades, master of none, or you get master providers that might not know enough about other things to like have a good bigger picture perspective.
Right.
So,
and that's where collaboration is key.
It's so important. And you got to be able to recognize. And the other thing I wanted to learn was I wanted to know who the best people to send my patients to were. Because some people will claim to be really good or to do this or to take the courses even and have the information, but experience is another part of that. You got to have experience too. And you have to have enough humility to know, like, when I started off, I was charging nothing to do tongue tie releases, next to nothing. I was not making money doing this. It was more just to learn and help the parents and say, and I would tell them, hey, like, it's kind of new thing. There's not a lot of research on it, but I want to help you out. And I think that this can help your baby. And they would trust me and we would do it and I would learn from it. If it didn't go well or if it did go well, you learn and you got to like have that mindset. I think having that sort of mindset is really important. And so I try to align myself with those sorts of providers who can.
And I think you hit the nail on the head too when you said it's learning. And that's one thing I've heard from quite a few of our guests. You can't stop learning. Great. You went to med school, you went to dental school, which, wow, incredibly hard, and you made it through. But you have to keep going. Science changes.
Change it quickly. And
yeah,
we can't always wait for evidence to come up to help our patients. Because that, we know, 17 years for the evidence, once it's proven and written, for it to catch up and be put into standard of care. It's a long
17
time.
years. That child is an adult now and the damage is done.
Yeah, it's way too late. So we know enough to know that early intervention can be beneficial. We see it. I post cases on my Instagram all the time, kids that I've treated and how it's helped them
Hmm.
with expansion, and you can see the difference. I just posted one yesterday of a 4.5-year-old. We started at 4.5. Same thing. They couldn't find orthodontists that would treat them. They're like, no, 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 later on, later on. But we know what
Hmm.
happens later on. You're
Right.
limited. You're limited with what you can do. Okay, now this kid is super crowded. All right, maybe we just take out teeth to make the teeth fit, because that's
Right.
how
And now we have a
limited you are.
whole different problem. Yep.
And then we have a set of different problems. Now we're creating a different problem, but we're not thinking about that when we're practicing traditionally.
Right.
Orthodontists aren't thinking about it. They're like, but we're getting the teeth straight and it looks good. And they're not complaining. Well, they're not complaining about the complaints you look for.
Right.
They're
Because again,
complaining
they
about,
weren't taught.
yeah,
They don't know what they don't know.
about the airway.
Hmm.
Sleep is
Yeah.
rough, TMJ problems. And I actually remember, and this is also what got me to this place too. I remember when I was in orthodontics,
Hmm.
back when I was a teenager, and I had a lot of crowding. A lot of orthodontists even now look at me, they're like, you have a great smile. I'm like, yeah, they took out 4 permanent bilateral, bicuspids on me. I got all 4 premolars taken out.
Hmm.
And during that treatment, I really remember my jaw started popping. And I said to the orthodontist, hey, my jaw's popping all of a sudden. And I remember it was right after they closed up my spaces where they had extracted the teeth. She's like, oh, that happens to teenagers, it's common. And I'm but no, but it's corresponding to a certain event in the orthodontic treatment.
Right.
She's a great orthodontist, nothing on her. She's a wonderful orthodontist. I still think back and I'm like, she just doesn't know, they might not know that this can be a problem.
Right. And it's funny because
Or
what is
they're
it the
not
doctor?
thinking about it,
Yeah. And what is it that Dr. Moralia says all the time? Just because something's common doesn't mean it's normal.
I mean, it's normal. Exactly. So I'm like, great, you encounter it all the time, but did you ever stop to think like maybe this is not normal? Maybe it does correspond to something. Maybe we did cause this problem in this patient by doing
Mhm.
this. And that's what I want. I want that kind of provider working on me. I want the one that's
Same.
going to think about it. Because sometimes we are not perfect. Doctors aren't perfect. You can't expect them to not make mistakes, but
Well, you're human.
they're being mindful and they're looking out for
Mhm.
your best interests. And they're smart enough to think things through, not just like doing it just for fun or just to try out
Right.
for science. But like, you want somebody who's going to think through it thoroughly and can explain to you their reasoning, then okay,
Mhm.
let's check it out and let's see. And have a game plan for if it doesn't work. Okay, if this doesn't work, then we'll pivot and we'll go this way. That's
Right.
having thoughtfulness. That's the kind of doctor that you should work with. That's the
That you
kind of,
want. Yeah. Oh,
yeah.
100%. 100%. So at the end of every episode, I always want to hand it back to the guests because you are the experts after all for the final thought. So what is a final thought that you would like to leave our listeners with?
That's good. Well, I mean, I guess what I just said is a really great final thought. Be mindful of who you're working with and take the time to find the right person. Sometimes it might be a lot to have to go to different consults and get second opinions, but before you start treatment with anyone, take your time to get to know what their plan would be and how they function, how they operate before committing. Because when it comes to airway and tongue tie issues, the treatment is never a magic wand. It's not the magic bullet to do a tongue tie release or expand. It's usually a full comprehensive treatment plan that involves surgery, therapy, and other supportive care, body work. So before you jump into it, and just do your work, do your research. And don't feel rushed into it. I understand that when your children have symptoms, you want to do something right away.
Right.
You also don't want to create other problems. So take the time. Take the
Mhm.
time to do it.
Really good advice. Thank you so much for being on, Dr. Tran, and sharing so
course.
much great information.
Thank you for having me. I get to do what I love most, and that's to educate. So I appreciate the platform to do that. Thank you,
Absolutely.
Rebecca.
Absolutely.